Hi, this is my audiences. Um, Hi, my name is Alan, and today I'll be talking to you about Down syndrome. Basically it's a genetic disorder that occur in many diseases such as Alzheimer's disease. And as you can see, this children is like facing, looking upward and staring into space. It's very pity to see these children, especially in this kind of difficulty. And there's a lot of problems like this kid cannot face, and it's hard for him to work together as a team. Like socially, it's very difficult for him to talk to people even. Okay, this I got this source from Crossmark, and you guys should pay attention to this because if one day your kid has it, uh, it needs to be taken care of early before it's too late. Like basically, it builds up and it gets worse and worse if your kid is not treated. So you should get your kid checked up. And basically, there's three things I'll talk to you about based on three articles. The first one is macular structural characteristics. The second one is motion perception deficiency of Down syndrome. The third one is the risk of cardiovascular events of Down syndrome. Basically, Down syndrome patients has abnormal macular structures in their eyes, um, especially in their eyes. CST, which stands for central subfield thickness, shows that their retina is actually the retina is very thick and thick in the middle, especially. It shows that they have higher CST than normal group, which proves that they have abnormal macular structures. And I got this source from Brian in the year of 2016. Okay, um, so I just talked to you about the macular structure characteristics that appear in their eyes and why the way they look differently. You can see in their eyes. And next, I'll talk to you about the motion perception deficiency. Uh, yeah, so basically, patients do have motion perception problems. However, to a certain extent, basically, the method was that the scientists used was they have two groups. They have the normal group and they have the normal people and the Down syndrome group, where they all have the same ages. So the normal group same ages, the Down syndrome group have the same ages, and they have the same qual. Everything else was pretty much the same, so they can test whether they have motion perception problems. And they were observing the movement of the patient by doing some tests that involve visual evoked potentials. And as you can see in my third slide, this kid is very funny the way he positioned himself and his motion. And you can see that this man has motion perception problems. And I got this source from Del, Del Viva in the year 2016. So I just talked to you about the motion perception deficiency of Down syndrome. Next, I'll talk to you about the cardiovascular events that happen in these Down syndrome people. And basically, uh, patients with Down syndrome have higher risk of strokes, diabetes, and also congenital heart diseases. As you can see here, it says each day in the US, 10,830 babies are born. 411 of them are born with defects, and the highest number is 87, which is congenital heart diseases that I was talking about. And this is what these Down syndrome kids have to face. But however, they have a lower. I got this source from Sobe in the year 2016. However, they have a lower risk of ischemic stroke compared to the normal group. So that's a funny thing. They're higher in certain diseases and they have lower in certain diseases. And basically, they have 2.6% that occur in the Down syndrome people that have ischemic strokes as compared to 3.4% in the normal groups. So I got this from Sobe in the year 2016. As you can see, the ischemic stroke kids are, I mean, like, these are like, I would say like something like symptoms. You see there's like a drop, like there's a drop in his face, and a certain muscle weakness, and you can see on the left side is a bit weak compared to the top right hand side. So there's this, I consider this like, I would say symptoms of, when later maybe you grow older, he has his chances of getting ischemic stroke. So in conclusion, these are the three things I've identified to you: the macular structure characteristics, the motion perception of deficiency of the Down syndrome kids, and the risk of cardiovascular events. And I can say these kids are a pity in that they have to try to face all these challenges and try to adapt to their problems and be treated separately from all these normal kids. So I would say we are all considered lucky to be normal in certain extent. And yeah, so thank you for listening. And basically, these are my audiences.